Let me tell you about what's happening with super intelligent AI and how it's going to affect your job in healthcare. Let's talk about it. Microsoft just announced their new artificial intelligence system that performs better than human doctors at complex health diagnosis. This AI model solved more than 8 of 10 case studies specifically chosen for the diagnostic challenge. When these cases were tied on practicing physicians who have no access to colleagues, textbooks, or chatbots, the accuracy rate was 2 out of 10. This has dramatically influenced what's happening right now in healthcare, and AI is really at the beginning stages. What does this mean? In this new world where AI is better trained than a doctor who has years and years of study, what is going on? How these doctors and nurses who practice medicine every day are going to survive? Are you ready to understand this better and embrace this new way of practicing with artificial intelligence? So let's dive and talk about what's the future for AI in healthcare. First, we'll need to question our existing workflows if you want to move to this new future. Second, you want to make time to learn these new tools. And third, you have to realize that tech is moving exceptionally fast and humans will need to keep up. My name is Theo Harvey and I'm a serial entrepreneur who went from lowly employee to CEO who runs a multi-million-dollar healthcare startup from his home. I raised about $1 million from VC and investors. I work with large organizations like Cisco Systems, AT&T, Charles Barkley Organization, and Blue Cross Blue Shield. My mission here today is to help healthcare professionals like yourself prepare for the new normal in healthcare before it's too late. One of the things I talked about was what we need to question your existing workflow as a healthcare professional. There's a quote from Peter Drucker, who is a management consultant, that talked about the greatest danger in times of turbulence is not the turbulence, it is to act with yesterday's logic. As a healthcare professional, but generally, let's think about this, all professionals have an existing way of doing work right now, right? But guess what? It's based on an older set of rules. So for instance, as a doctor, you probably went to medical school and you learned these steps on how to treat patients and get to the root cause of the issues and solve their problems, which is admirable. It was first, evaluate, work up, diagnose, treat, document, and follow up. So if you evaluate, right, you want to understand the patient's story, symptoms, their past medical history. The workup, this is where you get the labs, imaging, right? Diagnosis, right? This is the key thing that you went to school for, right? What could be bothering the patient? Could it be congestive heart failure, pulmonary embolism, pneumonia? This is what they call a differential diagnosis based on your years of study, right? Using your clinical reasoning skills, right? So this is really the crux of kind of what you do day to day, right? Next, you treat. You want to start them on a prescription or see how they respond, that patient. Document. You want to chart this and close the loop, right? Before you move on to the next case, put some notes there. And then finally, you want to follow up in 2 weeks or so to see how the patient is doing based on your differential diagnosis and your recommendation and the medications, right? This process is something, healthcare professionals have been doing for ages, but this is changing. Currently, artificial intelligence can absolutely do a lot of these things, like the evaluation piece, the workup, the treatment, the documentation, the follow-up. The thing about this Microsoft announcement is that it's on track to handle diagnosis. So let's think about that. That means AI has gotten to a point where it can create better diagnoses in some cases than doctors themselves. If that is the case, what value will you bring to the table? Let me tell you about a time when I worked at a large technology company, right? And I was working on a technology that was the best in my department, right? I knew it inside and out. Everyone reached out to me if they needed help with this technology. Everyone came to me. I just felt very valued, really saw that I was doing well in the company because of that value. But when I really started to think about it, I realized that this tool was taking way too long to do, more like hours to use this tool. There had to be a better way. What I did was I learned a new tool that did my job in minutes. That's the thing about technology. It always improves and there's always a better tool. So not only did I become valuable with my department, but I became valuable across the country. And don't you think that made my value even that much better for the company? Likewise, you have to realize that sometimes you have to question what you are good at to find something you can be the best at. Let me say that again. Sometimes you have to question what you're good at to find something you can be the best at. This is likewise with happening in AI. Take some time. You have to realize that your workflow may be in jeopardy. It's okay. Take the time, unpack it, and understand what you can do differently to do better. So here's one action item you can do today. Take about 30 minutes a week and learn how AI can automate some of your current workflow. For example, artificial intelligence is rampant right now in healthcare when it comes to ambient listening tools, right? So to help with charting, why not get good at that tool that you're using in your hospital or in your clinic, that ambient listening tool? Be the best at it so people come to you about that tool, and learn other tools that are even better, that don't make as many mistakes or understand different languages that patients speak. This is be key. This makes you more valuable over time. I guarantee that investment, 30 minutes once a week, go a long way toward increasing your value and your peace of mind. Let's talk about the second thing. Sometimes you struggle with finding time when it comes to doing these things, right? I've been there. I'm raising kids. I'm trying to stay married. I'm running a business, keeping my health in check. Finding time for friends can be so overwhelming, right? And when I speak with hundreds of doctors and nurses, healthcare professionals, they all say the same thing. Matter of fact, burnout is a real thing in our society right now. 63% of physicians report experiencing burnout in 2023, up from 44% in 2017. And that's from Medscape Physician Burnout and Depression Report in 2023. Over 50% of nurses say they are emotionally exhausted and are considering leaving the profession, according to American Nursing Foundation survey in 2022. This is a real rampant problem, the overwhelmness. How do you find time to do anything, especially to level up your skills in this AI world? I have to tell you, I think that's a load of crap. Why? Because human beings are able to make time for things that are important to them. Let me say that again. Human beings are able to make time for things that are important to them, especially if there is a social element tied to it. I can tell you about a time my dad wanted me to play basketball. I was younger, he thought I was going to be the next LeBron or something. I don't know what that was.
I guess we'll never know.
But guess what? I said, I'm going to do it. I'm going to go hang out with him and do it. So I did it one weekend and it was okay. He was yelling at me, running all these drills. So guess what? The next weekend he said, you want to play basketball? I said, no, I'm going to watch my cartoons. Forgot about it and didn't even think about it for years until I got in middle school and high school. But don't you know, when I got around friends who were also starting to go on their basketball journeys and learn the skill sets, shooting, dribbling, that's when I got more passionate about it, right? So my tribe of friends were obsessed with basketball. So guess what? I became obsessed with it. And guess what I had time for? To train for basketball more than before when I was younger. Attention changes when you get around your tribe. So let me say that again. Attention changes when you get around your tribe. I think that is the case here. You have to find individuals that are looking to level up their skills in AI and making the time for it. And you find those folks, they would motivate you to level up your skills over time. Here's one simple way to get around your tribe. Basically, there's an online course that you can take that have similar professionals who will understand this as well. In fact, we are offering a free masterclass on how to use AI technology to grow revenue. Spaces are limited, but check it out below if that's something of interest. But it's definitely something where you can be a part of similar healthcare professionals who are tired of staying the status quo and looking to elevate their skills. So check it out in the show notes if that's of interest for you for that next masterclass. Finally, let's talk about how it's important to move fast. Why? Well, guess what? Technology is moving extremely fast. I don't think human beings can even keep up with how fast technology can move, right? Think about where we were 25 years ago. No iPhones, no Uber, no AI. So now we're in a world now where AI is here and is moving extremely fast and automating tasks and procedures and things that we didn't even realize that could be automated, right? However, will be the worst that artificial intelligence will ever be. That's right. That's how technology is. It always improves. Those who act now to learn will win more financially and career-wise if they do it today. There's a quote from Tony Robbins. Tony Robbins, if you don't know, is an entrepreneur and speaker, a life coach, if you will. He said the path to success is to take massive, determined action now. Waiting costs more than trying and failing. And the numbers bear this out. There are statistics that say early adopters of robotic surgery techniques earn up to 15 to 20% more than peers in the same specialty due to higher procedure volumes and referrals. Journal of American Medicine Surgery 2021. Interventional radiologists who learn and perform cutting-edge procedures like Y90 earn up to $50,000 more annually than those sticking to traditional methods. And doctors who regularly participate in continuing medical education or CME on new technology and treatments are 1.5 times more likely to be in the top quartile of income for their specialty. Again and again, the data has proven out that those who stay above their peers when it comes to learning new tech, learning new skills, will see the financial rewards sooner than most. And I think this is the key. My action step for you today is to start your AI education journey today, and you will absolutely see the financial impact in time. As we move in this new world of artificial intelligence and why it's important to get your education and not be left behind on the spaceship first, you need to question your existing workflows, unpack them, figure out ways to improve them. Don't just wait for them to be impacted later. You be the one that disrupt them for yourself before it disrupts for you. Second, you want to make time to learn these tools. Get around a tribe of individuals that want to learn as well. So you're motivated to pay attention to how to do these tools better. And you're not distracted by other things that come into your life that are important, but this you have to make time for. And then finally, you have to realize that tech moves exceptionally fast, and only humans who keep up with it are the ones who are going to win. Hopefully that was helpful as you look to understand where you can go with your career when it comes to artificial intelligence, especially in healthcare, and these new announcements every day of what's happening in the world of AI and transforming, workflows and the way you practice medicine or treat patients. So if you like this video, we talk about tons of things like this all the time on this channel, AI, healthcare, technology, because this is the new normal of healthcare. And so you have to take advantage of it. Check out my other videos. We can give you more insight on how you prepare for the future of healthcare.